You know your body. Nobody else knows your body like you do. You have lived with it your whole life. You know when there's a change. If you think there's a change or you think there's anything, listen to it. It's your gut telling you, and go and get checked.
So with me is Aisling Keogh. Aisling is a Galway girl and a former national and international hockey umpire. She has been president of the Connacht branch and is currently on the board of Hockey Ireland. She has numerous strings to her bow and is also a part-time poet from a family of poets. She has ran for Galway City Council. She got married in January 2018 and was diagnosed with breast cancer the following month. So welcome to the podcast, Aisling. And if you'd like to maybe tell us a little bit about your story. So we might start with maybe your life pre-diagnosis, you know, who you are, when you got married, who you married, and we'll take it from there.
Yeah, thanks very much, Aileen. It's so nice to be asked to be part of this podcast. Well, look, I suppose, as you said, I was an international hockey umpire. I was involved in the Connacht branch, been involved in hockey since I was 7 years of age. My sister was diagnosed with breast cancer in 2009 and she is living in Canada. And I suppose as a result of that diagnosis, we as a family, we were being monitored as her sisters. So I kind of knew my body and I knew how things felt, whether it felt right or wrong. But I suppose up until 2017, I had still been umpiring. I had still been extremely active. I had always been active. I had to be fit to umpire provincially, nationally and internationally. But at that time as well, I was planning my wedding. I had been in a relationship with my partner who we met at a hockey tournament in Johannesburg in 2012. We were 5 years long distance, would you believe, over and back to South Africa. I find it funny because some people, you know, they give out if they have to go to Dublin in a long distance relationship, and we were going over and back to South Africa. But anyway, Tanya was moving over in 2017. And
so she is South African?
She is South African, yeah. So she made the move. We did debate as to whether I would go there or she would come here, but just with regards to, you know, a lot of different things, safety probably issues, me getting a job over there, it was easier for Tanya to come here. And probably as an Irish person, I would not have survived the weather in South Africa. It gets very warm in Durban. It gets up to 40 degrees.
Well, you're very fair-skinned, Aisling, so exactly. I can't imagine that you would have survived South Africa. And when did you get married then?
So we got married on the 19th of January 2018. Very small wedding because we had planned to have a bigger party in the summer that year. Now, prior to the wedding, I kind of had noticed a little bit of a difference in my right breast. It was very subtle. It was very deep. It wasn't a lump. It felt a little bit like steak grizzle. Yeah. If that makes sense. And I kind of monitored it for a while. It was.
And you said already you'd know your body, would you?
I knew my body because every time I get into the shower, I would check it. So I would soap up and with the padded part of my hand, I would always check my breasts.
And is that because you were so conscious because of breast cancer being in your family?
It was. It kind of just was a trigger for me. It was. I kind of got into this habit and it became the norm for me. So I just knew my body. And I'm so glad I did because I did wait a little bit before I went in for this check because
Did you wait because of the wedding and all the preparations for the wedding, or was there another reason you waited?
I waited because of the wedding, but I think I also waited because I was thinking a little bit in my head, am I being paranoid here? Mm. And it's one thing I always say to people, be paranoid. Be paranoid. If you think there's something there, go and get checked. Don't wait. So I think there was a combination there. So when I did then...
So when did you go? What was the first thing you did once you decided you were going to get this investigated?
So the first thing I did was I went to my GP. Mm-hmm. Because you can't just ring up and seek an appointment. I went to my GP and I said, can you, and this was after we got married, just afterwards, went to my GP and said, can you please refer me into the breast clinic? I said, I don't need you to check me. And she didn't. She said, okay, that's okay because you know yourself now. She could have checked me, but she decided not to. I said, just refer me in, please. Because I said, I feel like I've been missed.
And how old were you at that point?
I was 40 years of age. So she referred me in and I left work and I went in.
And did you go in by yourself?
I went in by myself and I still thought it was going to be routine. I didn't think anything of it. So I left work, I drove across, I parked up and I went in. And my sister actually worked for Carl Sweeney. She now works for Aoife Lowry, the breast consultant. And it was Carl who actually saw me. So he did.
Carl is a consultant in
Carl is the consultant in GUH, sorry, yeah. So Carl examined me and he said, Aisling, I'm not too sure. I don't really think there's anything there, but what we will do is we will put you through down for a mammogram, and if we have to do something further, we'll do something further.
So he was optimistic that there was nothing there.
He was very optimistic, yeah. And it kind of reassured me as well. So then I went down and I waited for my mammogram, and I was called in, and the lady that was doing the mammogram, she said, "Did you have surgery on your right side?" And I said, "No, I didn't, but I did have a cyst exasperated," I think that's the correct word, a couple of years before that. So I just assumed that was probably what she was talking about. So I was sent back to the waiting room, and then I was brought in for the ultrasound, and they did the ultrasound, and she said, "Where exactly do you feel it is?" And I pointed to the area, and straight away things changed very fast.
So how did you see things changing so fast? Was it...
She just immediately said, "Oh yes, there's definitely something." The nurse came up, she was opening a pack. I wasn't 100% sure what was going on, and it was a biopsy. She said to me, "Okay, you're going to feel like you're being shot." I said, "I've never been shot, so I don't know what it feels like, but we'll just go with it." So they went in twice and did it, did the biopsy, and then dressed me, gave me the instructions as to how to look after that when I left, and then I was sent out again to the waiting room. So I sat in the waiting room.
Did you feel yourself going back out into that waiting room that they'd seen something, they'd found something?
Still at that stage, I don't know what I was thinking or where I was. All I remember was walking out into that waiting room and everybody else was gone. I don't even know how long I was in there. So I sat there, and then the next time I was called in, I was called back into Carl, who had a nurse with him, Catherine.
And so this is the same afternoon,
This is the same afternoon. This same afternoon. And then they spoke to me, and I have no idea what they said. All I heard from that conversation was, "Now, when you come in again, bring somebody with you." So I left, and my sister worked in the optical department in the hospital. And I remember I walked over to her, and as I was walking over, then I think it started to sink in and hit me. And she came out and she goes, "What's wrong?" And I said, "I don't know. I've just been in the breast clinic." And then I broke down. Now, that was the only time at that I did actually kind of break down and get a little bit upset with it.
With the shock of it all?
With the shock of it, because like I said, it just turned so fast. And that was Wednesday, the 7th of February. On the 9th of February, then my sister, who works for Carl Sweeney, she collected me and we went over and we met with Carl again and the nurse, and my other sister was there as well.
Was one of your sisters who's had breast cancer?
No. So my sister has breast cancer is in Canada. These were my eldest sister.
So there's 5 girls in the family, is there?
There's 5 girls in the family, and I am second youngest in that. So 2 of my sisters came in with me, the older 2. So they sat in the corner and I sat down. And I remember the consultant was speaking to me, and for some reason, and again, this was probably my ignorance with the whole cancer journey and what happens, I didn't know. And he spoke to me and I thought he said precancerous. And in my head I went and I sat back and I went, "Oh, thank God." I said, "It's like a smear. It's precancerous cells." And he said, "Aisling, no, you're not listening to me. You have breast cancer." And I went, "Oh."
So it's almost like your mind had refused to accept it, and your mind heard different words than what he was actually saying.
Exactly. And then I turned to the 2 in the corner who were blubbering. And I just said, "Will he stop?" And I looked straight at Carl, the consultant, and I said, "Right, what's the plan? What do I need to do?"
So what were you actually diagnosed with?
So I was diagnosed with a hormone-driven grade 2 invasive carcinoma in my right breast. So it was slow and it wasn't aggressive. Which was the opposite actually to my sister. Hers was aggressive and fast. So I had a really good diagnosis. And I think a lot of that is down to breast cancer research, that the treatment now is so good for it. So I really was lucky. And I think it's one of the better ones.
And maybe also actually though down to what you said earlier, which has really struck me, which is be paranoid. I mean, you knew your body. You practically checked your body every day after the shower. So you were very aware of even a slight change.
I was.
Yeah.
I was, and I did it even when I had my period and when I didn't have my period. When I went into Mac and Keane, the oncologist, he brought his nurse over to feel it, and he looked at me and he said, Aisling, 90% of women would not have presented here with what you have. He said, you were very intuitive and very in tune with your body. But, and this is what I'd say, is that you know your body. Nobody else knows your body like you do. You have lived with it your whole life. You know when there's a change. If you think there's a change or you think there's anything, listen to it. It's your gut telling you, and go and get checked. And what's the worst that can happen?
Yeah.
They can say, yes, there's something there, or they send you home and say there's nothing, but be paranoid.
Absolutely. I love the be paranoid bit. And tell me, so your reaction was, you took it on the chin from the sounds of things. You said your sisters were very upset, but once the information reached your brain, you took it very well. Is that correct?
Yeah, look, I did. I'm not the type to Google things, right?
Yeah.
I don't. I just went with it. And I suppose what I did find was that when somebody gets a breast cancer diagnosis, the need is not in you. The need tends to be other people.
Yeah.
So other people have the need. They have the need to feel wanted, to feel that they're helping, to feel that they're doing something. Whereas I had a plan.
So can I ask you then, so when did you tell Tanya, and how did you tell Tanya?
So Tanya was away actually at the time. She was away with her sister and her mother in England. After the wedding, they had gone across because her sister is living in England.
So this is only 2 weeks after the wedding.
This
now,
is only
it?
2 weeks afterwards, yeah. So we had no honeymoon or anything planned like that because, as I said, Tanya's mother was over from South Africa. They needed time together. So, yeah, she was away. So I went in, had the diagnosis, came home, and then I tried to ring. I couldn't get through to her. And then eventually I got through to her and I just said, look, I said, everything is okay. I've had a breast cancer diagnosis, but it's fine. There's a plan. So I said, I don't want you to be upset. I said, we'll deal with it when you get home. Now, she did come home and then she had to fly to South Africa with her mother. So she wasn't around for the early stages of the treatment.
And how did she react to the information?
She was okay. Tanya's quite laid back. You know, she was upset, obviously. And
maybe it was your delivery as well, because you were making it very straightforward. You were saying, yes, it's there.
Yeah.
We have a plan and we're going to deal with this.
Yeah. And I mean, I think that's kind of how I always am. I mean, when my sister was diagnosed in 2009, my father then had cancer in 2012. He's actually just finished another cancer journey, would you believe?
Oh my gosh.
So I'm very practical.
Yeah.
It's like, don't panic until there's a need to panic.
Yeah. And you were only about 30 when your sister was diagnosed, were you?
Yeah. So that was 2009. So yeah, I would have been about 30. Yeah. 29, 30. And I flew over to her to help her with one of her rounds because she had a young child.
And was it a similar cancer?
No. So hers was a grade 3. Hers was hormone driven, and she had 4 rounds of chemotherapy. And then she was on Herceptin for a year because hers was HER2 positive, whereas mine is HER2 negative.
Okay.
So we had 2 very different diagnoses.
2 very different diagnoses.
Yeah.
And you said, and there was no genetic component.
No. So I went and I got the genetic test because apparently you can only get this if you're going through it. She had never gotten the test, and they said, no, you don't have the BRCA gene, but it's not to say that we don't have something else that has yet to be researched. And again, that's why research is so important with this disease. And as you probably know, I'm sure, friends, family, there's so many diagnoses now. So many people are being diagnosed. But as I say, I was lucky.
And so many diagnoses, but so many different types of diagnosis of breast cancer. So breast cancer isn't just one straightforward breast cancer. It presents in various forms and
it really does. And I mean, that's why I always say to people, mine wasn't a lump.
Yeah.
It was not a lump, because people seem to think, if it's a lump, it presents in different ways. And I think we need to know that. I also think that women need to be monitored a lot earlier than they are, because people are getting it now younger.
Absolutely. Yeah, because again, I mean, it can present as dimpled skin or wrinkled skin as well.
100%.
It sounds a bit like what you had in the grizzled steak analogy.
Yeah, exactly. And I mean, then even when you start your cancer journey, everybody's journey is different. So it's like, if somebody comes to you and you've had a cancer diagnosis and they come to you and they reveal they have one, don't start going, well, it's this, 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 because it's not. Mm-hmm. Everybody is different. Mm-hmm. You can help with the hair loss and the little tips about toothbrushes and stuff like that, because they're the small little things. Yeah. And that's what I help people with. It's like the small little tips that you can give to people.
But you can't say, well, this is what I did, so this is exactly what you need to do, because it's going to be completely different.
I don't believe so, no.
Yes.
No, it's very, very different.
So So what was your plan then? You told Tanya now. So so now you're starting on your plan, your treatment.
Yeah. So basically on the 9th I was brought in and basically told. On the Monday I went into work and I went across for my MRI. And the Tuesday I was back in with the surgeon, and on the Wednesday, Valentine's Day, I had a date with the oncologist. So that was fantastic.
That's a lovely date.
It was a lovely date. Yeah, it was a lovely date. Anyway, so that was the 14th of February. And on the 1st of March, I had my first round of chemo. And I was scheduled for 8 rounds of chemotherapy. And basically the reason that, so I had neoadjuvant chemotherapy. Because of the size of my tumour, it was 5 centimetres. I was a candidate for a mastectomy.
Okay, straight away.
So they gave me the chemo to reduce it.
Okay.
And then once it was reduced, I could retain my own breast tissue, and I had a lumpectomy. So I had 2 surgeries on that. So I was very lucky that it could be reduced with this chemotherapy. And I think this is something that probably couldn't have been done many years ago as well, that now, because all the research
absolutely medical advances and research,
exactly.
Again, it just shows you.
Exactly. Yeah. And the chemo worked very well, probably a little bit too well, because I did get very sick, but it worked.
Explain that to me. So in what way did you get very sick?
So my journey wasn't easy. And it's only when I look back, it's not to say that this is going to happen to everybody. It just started from my first chemo. So my first chemo tissued in my arm, which meant it came out of the vein and it went into the tissue. So, and I'm not a needle person. I was never sick. I was never in hospital. I never broken anything. So I didn't like needles. I know nobody does.
Yeah, you were a sporty outdoors girl.
Sporty outdoor, never even had an injury, you know. So, but I suppose when this happened too, you know, you don't say, God, why me? You say, well, why not me?
Yeah.
Why not me?
Yeah.
You know, this can happen to anybody. So it is me. I just have to get on with it. So anyway, the first chemo tissued, but I had an allergic reaction to the chemotherapy. I had rashes. I was violently sick. And then what I got was a thing called PJP pneumonia. It's a fungus that coats your lungs. So I assumed my sickness was down to the chemotherapy, and I did ring the nurse a number of times and said, you know, I'm really not feeling well. My temperature is up, it's down. And it was recommended that I didn't come in unless my temperature was up. But I suppose I didn't realise again. I conform.
You didn't realise how sick you were because you just assumed that this is all a side effect of the chemotherapy.
100%. And the thing is...
And there you were with pneumonia at the same time.
Well, it's like this, Aileen. If I had left it a couple of days later, I wouldn't be sitting here talking to you, and that's what I was told.
God, Aisling.
Yeah, so they brought me in. They thought it was flu. I was in...
where are we now? Is this the summer? Or is this...
So this is going into... I worked up until May. Then I went on 2 weeks leave, and then I got sick. I got the pneumonia when I was sick. So yeah, I had to leave work then. So I got the pneumonia. It was a fungal pneumonia that when your immune system is low, it coats your lungs. They assumed it was flu. They isolated me. Everybody that came in had to wear PPE. I had a chest x-ray that was clear. And then 2 doctors were in. One was on this arm taking out a line. Somebody was putting a line in here. And then he said, I'm going to send you for another x-ray because I'm not happy. And I went for that x-ray, and then boom, 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 everything. Blood transfusions, oxygen, steroids, because my adrenal glands were suppressed as well at that time. So they stopped working. And I was very, very sick. I was very close to being intubated. So I was in ICU in the Cara ward.
And how long were you in there for?
I was in there for 3 weeks. So I had blood transfusions as well with that. And so you were very unlucky in how you reacted to the treatment. And obviously, that's not going to be everybody's story either. It's not. But what I will say is that at the time, this was pre-COVID. I remember my sister gave me masks, and I was like, I'm not wearing masks. I look ridiculous. If I was to go back now, I'm telling you, I would wear the mask.
And actually, I'm bringing it, we'll come back to that again, but just your own story with PPE is you got much more heavily involved in PPE. Did you not in your own career?
I did, yeah. I was actually the PPE lead for the west of Ireland.
So being unwilling to wear a mask,
unwilling to having about 200,000 of them sitting in front of me in my job. I know, yeah.
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 So, yes. So there was obviously some sort of a linkage there made somewhere up
There
in
was,
the
yeah. But
territories.
in another way too, I was actually blessed with the timing of my diagnosis because it was pre-COVID.
Yes,
You
yeah.
know.
So you're now, so once you recovered from the pneumonia, were you back into chemo at that stage then?
So no, they didn't continue with the chemo.
Okay.
So what had happened was I was allergic to it. They were going to change it. Then I caught pneumonia and they finished it. They said it was, and it had done its job anyway.
Yeah.
It had reduced it down. So I had to wait 6 weeks before I could then go in for surgery. And it was that small, then you have to go in and you get a wire put in. So you go back over to the radiotherapist and they insert a wire into the small little tumour that's left. And then when I went up for that first surgery, they did the anaesthesiologist, anaesthetist. Sorry, I can't say that word.
It's a very hard word to say.
Yeah, it is. Yeah, try it.
Anaesthetist.
Anaesthetist.
Yeah,
Okay.
I nearly got it.
So he went in to do a nerve block in through my back into my lung. So
Like an epidural.
Yeah, but it was into my lung. So I had a screen in front of me and I could see this needle going into my lung and he was like, cough now. And I said, okay, I'll cough. So then I went in for the surgery and they removed the tumour that was there and I was perfectly fine after it. I had no pain or anything like that after that surgery. Then I went back in for the checkup and they said, we need to get more margin. Just because there's a few extra bits, so we need to get more margin.
So there's a second surgery scheduled
second
then,
surgery in again.
Yeah.
And that again was no issue. And it was very neat, very, very neat. There's a little dent there, all right. So that was fine. And then after that, it was 30 rounds of radiotherapy.
And how did your body react to that? I mean, how did you deal
I
with
was
that?
actually fine. You were in every day. So Monday to Friday. It was only towards the very end that I started to burn. So, but the thing again, like this, I didn't Google anything, Aileen.
Yeah.
I just turned up. If they told me to come in, I came in.
Yeah.
Right. And some people are great at Googling. I'm just, it's not my thing.
Well, I have to say, I'm a sister of yours there. I mean, I don't go near Google. I'm too afraid.
But that's it.
But also I'm afraid that I might be misdirected. I prefer to go through proper empirical research
100%.
and scientific research and know what it is rather than go through Google.
Exactly. But also I'm an awful wimp. And
Yeah.
if I know what's ahead of me, I won't turn up.
Yeah.
So they brought me into a room and you actually get, well, at that time, I'm not too sure. I know radiotherapy has advanced so much as well, but I got tattooed. So I have 3 little dots where they mark you up. So the reason that they do that is because it's so technical and so hard when you're lined up to get this radiotherapy that it's so precise.
So for them to know each time, rather than putting a little marker each time, they actually tattoo
They
3 spots.
So it's permanent. Yeah. So I now have 3
So
tattoos.
that's another little mark for you there.
That's 3 tattoos.
So 3 tattoos.
3 tattoos. I know. I'm very proud of my
Yes,
tattoos.
I'm sure you
to be
are.
honest. Yeah. But I think he was training in the girl who was doing them because I didn't expect it, and in between the breastbone.
Oh, I'd say that was sore, was it?
It wasn't nice. Now it wasn't nice, but look, it was.
So you came through the surgeries very well, but the 3 tattoos nearly
the one
polished
tattoo.
off.
So I said I won't be going back for another tattoo anytime soon. But look, the radiotherapy was fine, and the staff and the hospital are just phenomenal, I have to say. And just to go back, just on a couple of small points, if you don't mind, I didn't have salary protection, nor did I have mortgage protection.
God. Yes, I mean, again, I think maybe that's the end of it that people don't think of when they think of other people or themselves.
Yeah, and because I
It
went
just never
through.
occurred to you, obviously, did
Never
it?
occurred to me, even though my sister had it. It never occurred to me that I was going to walk in and I was going to get diagnosed. But I also don't have health insurance. But I have to say, I was in the public system and it was absolutely phenomenal.
Well, again, that's great to
phenomenal.
know for anybody that the public
Yeah,
system.
absolutely brilliant. So look, I cannot fault it at all.
But you managed to get through it, obviously, financially.
I did because I had to go back to work. I had no choice but to go back to work.
So when did you actually go back to work?
So I went back to work in March 2019.
In the HSE?
In the HSE because I was going off pay.
And that's before you took over as PPE lead then during COVID?
Yes, because I was going to go off pay and Tanya had only moved over. She couldn't work for the first year. So I had to pay a mortgage. I had no choice. I had to. So if it's one thing I'll say to people, just kind of make sure you have those things in place because I was a bit silly not to really, to be honest with you.
Okay. Well, I have to say now, so far, we've got 2 big guidance points, which is be paranoid and make sure you've got the financial protections in place in case something does happen
Just
to you.
in case.
Yeah.
Just
particularly
in case.
when I suppose when you've got a mortgage in your own name and
100%. Yeah.
So can I ask you then, how you're now through the treatment and you're back at work and you're well. How did you feel about yourself and your body? Did it change your perception of your body? Did you feel different? I suppose, did you feel different towards your femininity? If you don't mind me asking, but how did you feel overall towards your whole body image?
So there was a number of things with that. So there's a picture of me when I had my first round of chemo, and I'm me. I'm Aisling. But once I got the PCP pneumonia, the steroids totally changed my body. I also, for some reason, was thinking, I mightn't lose my hair. I might be this wonder person who doesn't lose their hair. You have all these silly things that go around in your head. But I did, and my head was shaved by my sister's boyfriend, Paul, and he was very good. My sister held my hand because I got upset.
Did you?
But I got upset because it was relief.
Yeah.
It was relief to do it, because I was for some reason, I was still wondering, will I, won't I, will I, won't I?
So once it was done, it was done.
Once it was done, it was done. It was an absolute relief to get it done. But I never got a wig. I didn't get a wig. I decided just to opt for a soft cap. Now, there's something else that I did do and I shouldn't have done, and I'd say to people, don't do it. I used to use a scrub on my face and I used it on my head. It wasn't a good thing to do because your head skin is very
too
different.
hard on your.
Of course it was. So I came out in a lot of lumps and welts. Again, silly thing to do, but I didn't know.
Yeah, but how would you know? How would you know?
Yeah. How would you know?
Yeah.
So I do remember when I was in hospital and I was quite ill, I had a shower and there was a big full length mirror in the bathroom. And I looked at myself and I was just a block. I was bald. There was no hair on me. I was totally different. Couldn't recognise my face. And I remember banging on the mirror and saying, wake up, Aisling. Wake up. I was convinced I was in a dream. Yeah. I'll be honest, I struggled a lot with how I looked because I was bigger than I had ever been in my life. I always thought I'd like short hair, but I missed my long hair. I missed it.
And how was your hair growing back?
My hair was okay growing back. It came back. I didn't get the curls like everybody said, thank God, because I don't really like curls, to be honest, and I wouldn't have liked them on myself. They suit some people, but I wouldn't have liked them. But it came back a little bit grey, and then it took a long time to grow, but it's not great. I now have extensions in my hair.
Well, aren't extensions marvellous things?
They're
Because you look like you have a great head of hair.
They're fantastic.
And I wouldn't know for one single second.
Well, I wish I knew about them a few years ago, to be honest with you.
Yeah.
So they're fantastic. But no, it's taken me a long time to get back to being me. I started exercising a year and a half ago. I started to do box fit because my muscles, everything were gone with chemo. My body just wasn't what it used to be. And I'd say to people,
particularly because you'd been so sporty as well. So to then have to come all the way back up again.
Exactly. But I kind of as well, I used it as a bit of an excuse not to go back to exercise. And also
that could be easy enough to do as well.
It can. Yeah. But also what happened to me, and it's not something I would ever have done, I kind of formed a little bit of a relationship with food. I found comfort in food. And that was something that I never had done, but I found comfort in food. And that was when my taste had come back as well, and before it went. So look, I'm just finally back to myself now.
So you're 5 years now, are you?
So 2018, finished in 2019. Yeah, so it'd be 5 years. Yeah, so I've been on tamoxifen for 5 years and I'll be on tamoxifen for another 5 years.
And do you feel, that it took you the 5 years to get to where you are now in terms of not just physically, but mentally, and how you have, how you've responded and how you're going to go forward with your life?
I think I definitely had PTSD.
Yeah.
And I still think I have a bit of it. There's a lot of trauma.
Stress disorder.
There's a lot of trauma there. It's always kind of.
Did you know you had PTSD, or is it now that you're recognising that you probably had it?
No, I actually, believe it or not, I suffer a lot from migraines, and I went into the neurologist and they referred me into a clinical psychologist that they now use for migraine, and they do a certain therapy. And a lot of the stuff that came up was the cancer diagnosis and visualisation of that and what I had gone through. And she had said, yes, there's definitely PTSD, and it helped an awful lot with it. But I think when you're on that treadmill, Aileen, you kind of have something to do. And I've always been on, I always have to have something. I don't want to stop. If I stop, I'll think, and that's the problem.
Yeah. But you're kind of running away from your thoughts almost.
You're running away from it. Of course you are. And when you're in it, you're in it,
Yeah. And despite the fact that actually, I think you've heard it, from everything you've said there, you were extremely positive in how you took the news, how you responded, knowing that you were going on the treatment plan, following through in the treatment despite, your adverse reactions. But still, there was so much things to deal with. Is that right?
There was an awful lot to deal with. And I won't say that I went through it without, not having a day where I fell. I did, because at one point, and when you're that sick and you're in hospital, the consultants come in very early in the morning. You're on your own. You actually don't hear what they're saying. I had a consultant come in, the respiratory consultant, and she said, Aisling, do you know how sick you are? You're a very lucky girl. You're a very, very lucky girl to be sitting here today. And she said, did you ever think about secondaries? And I just went, Jesus, what?
Yeah.
Why
So it hadn't occurred to you?
No, of course it didn't.
Yeah.
It did. I was dealing with the primary. It didn't occur to me. And I remember at that point then I had a dip and I rang my mother and I asked her to come in, and that was a bad day, but I soon got out of it, But the need, as I said to you already, it's everybody else's need. So you do stay positive for everybody else, because you don't want to see, I'm not the type of person, I don't like to be vulnerable. Don't like to be seen to be vulnerable.
And speaking about everybody else, can you tell me a little bit about the calendar that your mum made for you or during the year of your cancer?
Yeah, and this is, it's funny. My mother has spoken about this calendar so many times, and she called over to me this morning and she just gave it to me. She's actually marked every single day. She even has from my wedding, and then she's marked from my diagnosis, and it's gone through the whole year,
So what kind of things does it say?
So,
without being too personal, obviously.
God, I wish I had my glasses. So here it has feeling sick. Then she has that mom cut. Oh yeah, this was a little story. So for the first bit of my hair, I did ask my mother, would she cut it? I said, when I was a child, you gave me my first haircut. Now that I'm going to lose it, I said, would you mind giving me my first haircut again?
Because you're thinking to yourself that no matter how bad it is, sure, it's coming off anyway.
It's coming off anyway.
Have a go with it,
exactly. And it wasn't great when I was a child either. It was like she put a bowl on my head. So it was no different this time either, I can tell you. So things like that, and feeling well today, blood tests, all that. And I'll tell you.
And she followed that right through.
She followed
from the
right
wedding
through.
day right through 2018.
Right through 2018. And,
And where does it finish off in that calendar?
Actually, she has at the end of November, but that's after the surgeries and stuff. So it was before my radiotherapy. This is her last entry. Thank God, all well, tired, but well.
Well, now I have to say, doesn't that sum it up?
It does. It really does. And I'm blessed to have this. And I think it's such a nice thing.
It's a fantastic thing. I mean, I've seen it. It's a fantastic thing to have.
It really is, yeah.
Because it is the journey of your cancer. And I suppose, on that journey, do you feel, did it change you as a person or your attitude to life?
It's funny. I'd love to say it did. And at the time it did, because, I always heard people going, if something happens, what do I want? I want to travel here. I want to travel there. All that I want is to spend time with family and friends. And I don't want to, I used to be afraid to fail, and I would never give things a go. Since my diagnosis, I'm no longer afraid to fail, but I'm afraid of regrets. And I don't want to have regrets in my life. So if I'm asked to do something now, I will say yes. Hence why I'm sitting here today. I never thought I'd be sitting on a podcast with you, Aileen, talking about this. But, it's the simple things in life. And I was blessed with the people I had around me. My mother was phenomenal. My father was phenomenal.
Your sisters?
My best friend, my sisters, Tanya. Everybody. They were just phenomenal, and I can't thank them enough, because I couldn't have done it without them. And I'm a quite independent person. Yeah. And there were times, I'll be honest, there were times when I was going in for my chemo and there was always somebody with me, or radiotherapy. And sometimes I go, I think this is a key point, and this is not to put them down for supporting me, but there was a space for me to have space on my own, to be with my peers who were going through it, to have an opportunity to talk. And I wasn't afforded that opportunity because I always had somebody with me, and then I couldn't be vulnerable because I had to be strong for my family and friends. Does that make sense?
100%. So I get that fully. So they needed to be there for you. Mm-hmm. You didn't necessarily always want them with you, because there were times that you wanted to just be with other people who had cancer, with other women,
and talk to them. Yeah. And I think at the end of the journey, So
would you say to another woman who is, maybe going through this, are you better off sometimes just saying exactly how you feel?
I think so.
Rather than just being kinder to your family?
I think so. I think take that time, do it for yourself, even if it's just one round, one appointment.
Yeah, where you say, listen, lads, I'm happy enough to go it alone today.
Yeah. You can drop me off and you can pick me up. There's absolutely no problem.
And I think once you say it, nobody's insulted or nobody's hurt.
I don't think so.
They're not going to know that because they're going to think, oh, she's going in by herself. One of us has to be there.
Exactly. And that's it. So I just think it's a key point and people should remember it. But the other thing that, Cancer Care West is fantastic. But, my mother brought me in when I was first diagnosed and I was sitting in there going, what am I doing here? It's not my thing. It's just not my thing. It is for other people. But
so you have to do what's your thing as well, don't you?
You do. But you're trying to, as I said, you're trying to look after other people's needs. Put yourself a little bit first in this. You need to be kind to yourself. You need to mind yourself. But when you're finished the journey, it's like coming to the edge of a cliff and then you fall off. Everything is full on. And then it stops. Everybody's gone. My sister stopped with the Meals on Wheels. I was getting shepherd's pie for ages. Then I was gone. I was like, hello, I'm still kind of, I'm still not great.
I still like shepherd's pie.
I still like shepherd's pie. My taste is back. Please give me another one. But you are. And I think, so, and this is my point. And like I said, Cancer Care West is fantastic, but it's not for me. I have met people who have gone through this journey and we have this thing in common. You kind of just know, you just have to say one thing, and the one thing could just be, you get it, don't you? And they look back and they go, yeah, I get it. Because you're faced with your mortality no matter what in this journey. You're faced with your mortality. Yeah. I know we all are because everybody's going to die at some point, but you're faced with it a little bit sooner. And, I'd like that little bit of a peer group, but I don't want it to be a cancer group, if that makes sense.
It does.
Yeah,
absolutely makes sense. Yeah. And I think what I would take out of that is that you just have to be brave enough to say what you're feeling rather than being entirely responsible for everybody else's feelings.
Exactly.
So what would be your key takeaway? I mean, you've mentioned a good few key takeaways there. I mean, I as I say, I loved the, be paranoid, know your body, tell people how you're feeling, the no regrets and say yes to everything if you can and if it's going to be in your best interest. But of all of those things, what would be the key thing that you would say to any woman who is either pre-diagnosis or has a diagnosis but in relation to breast cancer?
Be kind to yourself. Be kind to yourself. Have some self-compassion. You need to have a little bit of self-compassion. Listen to your body. Listen to what you're going through. If you need to be sad, be sad. I didn't do it. Listen to all those things because otherwise it's going to catch up on you.
Would you like to have been more sad in a way?
I think at the time I probably should have during it because I definitely went through a grieving process after it.
Yeah.
I grieved who I was.
You could have done that during it.
I could have done it during
blocked it.
Yeah, I blocked it because like I said, and again, I'll say it, the need was there for other people to keep other people up. I'm fine. I'm good. Don't be crying. Don't be sitting looking at me crying. I'm fine. But it doesn't allow you to take that time then.
Yeah.
Because there's somebody always with you. Give me the time. Give me the space. Allow me to have this moment and allow me to reflect and know what I'm going through. And I suppose there's a little bit around that too, is that, when you're sitting in a cancer ward and you're getting your chemo, there's always somebody worse than you, Aileen.
Yeah.
And you don't either want to be that person either, and this is what keeps you going. You have to fight. I don't like the term cancer survivor. I like the term cancer warrior. And I was looking at an email from my sister last night and she was talking about her journey through chemo. I hadn't seen it in years, since 2009. And she talked about the rounds of chemo. And she said, it's like boxing. And it is. You're boxing.
You've taken up the boxing, haven't you?
I have. I have. And I'm fitter and stronger. And, it's a great thing. And, just mind yourself.
Well, Aisling Keogh, cancer warrior and boxer and poet and hockey umpire.
An election candidate.
And, you also stood for the Galway City Council. I forgot that. That was last year, was it? Or was that this year?
Just this year. Not something I ever would have thought I'd do.
And a hair extension fan.
Yes, because I had to go onto a poster, Aileen.
Yes, well, I'm sure you're looking very good in that poster.
But I'll just say one last point on that. The first time I recognised myself again was when I sat in that hairdresser's chair and the extensions were put in. And when he put the brush through it for the final time, I looked at myself in the mirror and I cried because Aisling was back.
Well, Aisling, you certainly are back because I'm looking at those hair extensions and you look fantastic. Thank you so much for telling your story and giving us the time and for being so, I suppose, so so human in how you told us, so funny, and for swinging your hair around the studio here. So thank you very much, Aisling. That was fantastic and inspiring and entertaining.
But thank you very much, Aileen. I really appreciate the time. Thank you.
With me is consultant breast surgeon and research director of the National Breast Cancer Research Institute, Professor Michael Kerin. And thank you very much. We're delighted to have you, Michael. And I just want to talk to Michael a little bit about the work of his own role and the work of the National Breast Cancer Research Institute. So I suppose, rather than me rattling on, what is your role, first of all, in BCRI, and what does BCRI do? And why is it important? So they're the kind of the key things.
Okay, well, the National Breast Cancer Research Institute is a voluntary agency that raises money for a research program. The research is carried out at the Lamb Institute for Translational Research based on the grounds of the University Hospital. And we do a whole spectrum of research incorporating translational research, near patient research on breast cancer. So over the years, we've contributed to such things as the genes that cause breast cancer, markers of cancer in the blood, how we can identify new targets. We're doing work at the moment looking at how microwave breast imaging can augment the diagnosis of breast cancer. We've done lots of studies near patients looking at why some people relapse, why some people don't, why treatments are more effective in some than others, and so on.
And that research that you have done to date, I mean, how far has that moved on the outcomes of breast cancer?
Well, breast cancer outcomes have changed dramatically. So we're part of a global war on breast cancer, or a fight to improve the outcomes for people. When I started out in the 1980s, 50% of people who got breast cancer died from it. Last year in Ireland, the mortality rate was down to less than 85% of people now survive. 85% of people.
Wow.
And, there's different combinations of factors that have come to place in that. Earlier diagnosis is a huge one. So we have a national breast screening program now in patients between 50 and 70. That leads to earlier diagnosis in people at peak age for getting breast cancer, and that translates into better outcomes. We understand a lot more about the molecular biology of breast cancer. There's different subtypes, as we call them, 4 common ones, and they're based on whether patients have hormone-sensitive breast cancer or not, and whether there's a marker called HER2 that's expressed on tumours. So about 70% of patients have hormone-sensitive breast cancer, and they don't have HER2. So that's luminal A type breast cancer is the commonest type. And then we get into other types like luminal B, which is more aggressive and usually has a HER2 marker on it. We have triple negative, which doesn't express estrogen or progesterone receptor. The hormone receptors are estrogen and progesterone. And those markers are expressed by the majority of tumours, but the triple negative ones don't express those or the third marker I talked about, the HER2. So we treat those differently. So they usually have chemotherapy, for example. One of the great changes, actually, that's happened over the last few years in breast cancer treatment is we now understand that some patients with luminal A breast cancer don't derive any benefit from chemotherapy and they don't need it. So we're able to do genetic studies, the Oncotype score it's called, where we look at 21 gene signature on the tumours, and there's a score given from 0 to 100. And if the patient is postmenopausal and has a score less than 25, there's no need to give chemotherapy. And the majority of people over 50 with breast cancer fall into that category.
And what's the treatment offered to them then if it's not chemotherapy?
So surgery. Surgery is still the best treatment, though surgery has improved greatly in terms of how aggressive it needs to be. We still need to do mastectomy, but not nearly as frequently as we used. So it's usually a lumpectomy. And then the treatment is always associated with a gland harvest. So we take nodes out, and now we call them the sentinel node, the targeted lymph nodes that drain the tumour. So the majority of patients now would have surgeries that involves lumpectomy and sentinel node biopsy overall, rather than more aggressive surgery than that. And then obviously we need to give anti-hormone treatment, and the majority of people who have breast conservation will require radiotherapy. But again, the length of time that they require radiotherapy for, the number of grays we give, is now dramatically reduced from the old days.
You mentioned there the breast cancer screening program, which is offered to women over the age of 50. I mean, is there reason to believe that should be offered to women at a younger age, over the age of 40 or 45? I mean, I'm just even noticing in the women that we are interviewing here in these podcasts, about half of them are under the age of 40.
Yeah, it's a real problem. And that's one of the areas of our research interest at the moment, is to actually pick up cancers earlier in younger women. So there's two challenges. One is that the tests we do aren't that effective in the younger, dense breast, right?
Because of the denser breast tissue, is it?
And then the second thing is the incidence of breast cancer. 1 in 400 women a year get breast cancer from the age of 50. Under 50, it's about half that. So it doubles in incidence every 5 years. So about 12 girls in the country get breast cancer under the age of 30 every year. And then it doubles. So once you get up to 50, it's 1 in 400, or, the significant number overall. The peak incidence is about at 58 overall. But then, say at the age of 40, most women have dense breasts, and the incidence of breast cancer is about 1 in 2,000 per annum. So you'd need to be screening a lot of women, and then the test you do wouldn't be that good at picking it up if one was to use mammography. So that's why we're trying to concentrate on perhaps other ways of screening the breast, or looking for biomarkers of early detection of breast cancer, but we're not there yet.
Perfect. So that makes sense. So there could be other markers that could be picked up if breast density is a problem at that age.
Yep.
And obviously, you've mentioned some of the advancements that have been made, and a lot of that is because of the money that goes into the National Breast Cancer Research Institute. But, again, and you've kind of touched on it there, but what is the vision for the future for bringing it on?
Well, there's 2 or 3 different visions, and they're all entwined. The very first thing to say is that all great organisations, I like to talk about the academic medical centre model, where you put clinical care, education and research into the loop to deliver better outcomes for people. So in the context of the West of Ireland and the National Breast Cancer Research Institute and the LAM Institute, it's a huge help to us in our vision to actually create an enterprise that's fit for purpose as a cancer centre, to be able to have a strong research arm to what we do. It allows us to recruit and develop some of the very best people into it. So that's a really important aspect of it. To that end, we're developing a European accredited cancer centre here, which will be of major benefit for the people in our own region. Right. So that's a first common thing I think that we need to talk about. The second thing then is to be part of the global intellectual war or management of cancer programs. So over the years, we've contributed to lots of aspects of that. Like when I was starting out, we didn't know about the BRCA genes. So if families have the BRCA genes, BRCA1 or BRCA2, then it's very likely that the girls will get breast or ovarian cancer if they have the bad copy of the gene. And we're now into a situation where we do risk reduction surgery in the people who want that done, or at least put a very strong screening program in place that allows 6 monthly MRI and mammography to be done. So, say the genetics component of what we do.
And actually on that, are there more genetics that can be done there? I mean, there must be other genes outside of those BRCAs, because there are a lot of women presenting who have a genetic history, but they're not being picked up here.
Yeah, and we've done lots of work on that as part of the BCAC consortium, the International Breast Cancer Association consortium out of Cambridge. We've had 2,000 patients who got breast cancer in the West of Ireland and 2,000 who lived old and didn't get it, and we've contributed their DNA into the programme overall. And that programme has revealed that there's the 2 big genes, BRCA1 and BRCA2, and they're autosomal dominant and so on, and they tend to cause the girls who have the bad copy to get either breast or ovarian cancer and get it at a young age. There are secondary genes that we've identified, be FGFR2, BRIP, lots of other genes. The challenge for us is to know what the right means of managing families with those genetic variants, because in truth, probably more girls will have the genetic variant in the family that don't get breast cancer than those who do. So we have some work to do to identify which ones are at risk of getting the cancer, having the genetic variant overall. Only about 3% of all sufferers from breast cancer have either BRCA1 or 2 abnormality. And of course, it can be inherited from the dad as well as the mum. So, and that's one of the factors that I think people find surprising, because a lot of women would say to me, well, my mother didn't have it. But sometimes if you look at the dad's family history as well, that can be equally important. And I tell people, if a man has breast cancer, they only represent 1% of all cancers, then the chances of them having a BRCA abnormality is significantly higher than any woman who gets it.
in terms of that, and in terms of, there's a biobank or something at the Lamb Institute, is that right?
Yeah.
And what does that hold?
So we've one of the biggest biobanks around it. That holds blood and tissue from people who've had breast cancer. So it allows us to do genetic-based research. It allows us to address markers. And one of the big things overall is if somebody gets a breast cancer and gets treated and is unfortunate enough to relapse, then it's fantastic to be able to look at the changes that have occurred in the tumour from the primary diagnosis to the time of the secondary diagnosis, or even to compare two cancers that arise in the same individuals to actually address the impacts of treatment or the long-term outcome in that setting.
Look, I mean, just from what you've told me there, the advancements are obviously colossal, and in terms of the mortality, I suppose that's the biggest outcome you're going to see is the reduction in mortality.
Yeah.
Where are we? You mentioned Europe there a while ago. Where are we, I suppose, in terms of Europe or America in terms of breast cancer research?
Well, you see, we contribute to international consortia right across the world. The BCAC consortium that I talked about had patients from all over the world brought into it. So one of the challenges is to actually address, one of the things that we've done, for example, in the Lamb Institute is we've been the first in the world to identify microRNAs in the blood of patients with breast cancer as a marker. And we have, lots of studies that we contribute to in that space overall. So there's areas that you can lead the world in, but what I would say is that all great units need to have a research component to what they do for the development of the next generation of people coming through, but particularly to enhance the ability to take care of the people that are in it at the moment and derive a personalised approach to management.
Michael, I suppose the most important thing for any woman who's listening to this podcast, whether she's pre-diagnosis, mid-diagnosis, in treatment or in recovery, is what would you, and obviously it's very difficult to push it, to encapsulate it into one sentence, but what would you say is the one take home for her to know, or the one bit of guidance, or just something that will stay with her?
Stay positive. You're not alone. It's a very challenging time when people are undergoing treatment. Having a supportive network, and that involves colleagues and other people who've been involved, who understand what needs to be done. We've multidisciplinary teams now that are in place across to look after people are really good in that space. And there have been huge developments, and those developments, I think, will only get better in terms of a personalised approach. So there are lots of emerging targets. There's lots of better ways of treatment. And in general, with breast cancer now, the story is positive. People go through a challenging time with treatment, but they usually get out the far end and are okay.
Thank you very much for that, Michael. That's fantastic. And congratulations to you on all the work that's being done by the National Breast Cancer Research Institute.
It's a pleasure. Thank you, Aileen.
Thank you.